Hello and welcome to this short series on aligner therapy using 3D direct printed aligners. My name is Dr. Jean-Marc and today I want to speak briefly about a misconception we have in aligner therapy, and it's designed by the fact that the way the teeth are moved in different systems, either fixed orthodontics or aligner therapy. So we call this force-driven versus displacement-driven tooth movement. Force-driven comes from the applications of forces by orthodontic arch wires, and these are held in position and activated through different types of brackets. The orthodontist calculates the force driven that is necessary to move the dentition, and in response to the force system applied, the tooth will move in its correct position or in the planned position by the clinician. To illustrate this, you can have a look at this premolar. So if I want the premolar to come to this position, as an orthodontist, I understand that first I need to put at the center resistance, I need to place a force, a distal force, and because the tooth has to rotate, I need to apply a small moment. This system will result in this premolar moving to this position using this force system right here, one. But we are also aware as orthodontists that this force system will be found if assuming I am pulling from this molar, so the action and reaction, action being here and reaction being there. So this molar will feel the same force in the opposite direction and will also have a moment on the other direction. So it's called anchorage, and that's the force system that we have to control during our orthodontic treatment. And this is the force system we are planning. When the premolar is positioned correctly, then we can move on to the canine and the malocclusion will be corrected. So that's force-driven system. The displacement-driven system used in orthodontics is mainly applied to aligner treatment, where this time the software that we are using will be moving the teeth or displacing them in space without any information given to the practitioner on which kind of force system will be used. So if we go to the same picture that we had before, if we want to move this tooth to this position, the aligner will just take the tooth, move it to its new position without even considering anchorage, and will let you know that it takes 12 aligners. And you will have also in the software, in many software, you'll be able to alter the amount of movement, which is the translation movement. Translation being usually 0.2 millimeters per aligner, and the rotation will be 0.2 degrees. And that's what the software will apply blindly if it's a premolar, if it's a canine, if it's a lateral incisor. It's called displacement driven. The problem you have with a system of displacement is the computer usually will place a simple force on the premolar using the aligner that will be transferred here, and we'll try to place a moment at the same time. And if this moment is small, probably the displacement driven will be effective. But the more discrepancy you get, or the larger moments that you need to apply due to torque characteristics of the position of the tooth at the initial movement, then the torque, as we have with a force driven, may not be effective and may end up requiring more aligners. So force driven and displacement driven are vastly different methods of looking at tooth movement, and they are specific to one type of orthodontic tooth movement. One is fixed orthodontics with wires and brackets, and the other one is aligner treatment with polymers, plastics, and software. So one is reactive and the other one is predictive. But you have to understand that the limitations of both systems to get the most appropriate treatment options. Thank you.